Hello, and welcome to the Meditation Movement podcast with the British School of Meditation.
In this podcast, we will share all things meditation, including showcasing the wonderful work that our register of meditation teachers are doing all over the country and further afield in helping so many people benefit from this amazing practice.
Meditation and community are our two biggest passions, and we can't wait to share them both with you in this space.
So sit back, relax, maybe even close your eyes, and don't forget to breathe. We hope you enjoy this episode.
So this is the Meditation Movement podcast, and I am absolutely thrilled to have Vikas Pandey with us today. Welcome, Vikas. It's really lovely to have you with us.
Lovely to be here.
So you are a consultant in emergency and vascular surgery based in Watford General Hospital. You are also the Royal College of Surgeons tutor and a wellbeing champion. Plus, you also have your own meditation service that you support individuals in Harley Steet, and you offer group tuition. You visit other NHS trusts. What other things do you have as well? What a role you've got there, Vikas. It's incredible.
Yeah, and I just wish I could do more. I'm just glad for the opportunity to talk about meditation, something I'm really, really passionate about. I do offer those services. I'm a surgeon by training, and it was actually I look back now and I see how meditation could have benefited me at every single stage of my training, but certainly it got to a point where the work pressures were just getting so intense, and this meditation was something that I have been exposed to throughout my life, really, and it was when I was changing roles and actually moving into the job that I work in now that meditation became a regular practice. And it's really when it became a daily practice that I noticed huge changes actually within me, people commenting on changes that are actually noticeable within a couple of weeks. And that's something that that's been consistent actually within my teaching career. So I wanted really to be able to offer meditation as I wanted to everyone to really be able to gain the benefits of meditation, irrespective of their background or their level of previous experience. And I really thought to myself, how am I going to be able to do this? As a surgeon, no one is going to be able to take me seriously. So I looked around at although I had a practice that I utilized, I looked around for courses on meditation training, meditation teaching. I looked around a lot, and then I came across the British School of Meditation, and it just seemed perfect. It's I think one of the only courses available that's externally accredited. It's a recognised diploma, and something that I proudly put. I put the BS diploma of the British School of Meditation letters after all my other my 4 other degrees and diplomas. So I do have a practice which at Harley Steet, which I have neglected because of work pressures. Have utilised my role as you mentioned. I'm consultant. My area of specialty training's vascular surgery. I'm also an emergency surgeon, and I'm the clinical lead for emergency surgery, as well as the surgical tutor for West Hertfordshire hospitals. But one of the roles which I find really quite fulfilling in the hospital is that of being a wellbeing champion and really being supported in that by the wellbeing team and the trust and my department, who've really helped me and supported my endeavours at promoting meditation. So I do offer some regular sessions to staff members, and I try to do an annual session, whether it's in person or live streamed, for Mental Health Awareness Week. I've been given a very nice, quiet office, which is great for people to just drop in. And I've been working at the hospital a long time, and most of the members of staff know where to find me if they need me. And indeed, I have people from porters to consultant colleagues drop in,
That's
just
amazing.
to get a little bit of peace and
Or a little boost as well, isn't it? A little boost as well. So, I mean, we're going to come back to you training with us, and thank you for training us. Thank you for choosing us as well, which was back in 2018, I believe. But first of all, I just want to kind of touch on, that for a little while, I guess that's what you were doing, this sort of balance of role. But then COVID hit, and COVID just took everything in a different direction. And I know with you, it certainly meant that you were working many, many hours, and life changed. Life changed from what you were doing before. So, and I think, and I guess that maybe there's still the echoes of that going on now. Is that the case?
It was a really interesting time. It was a scary time for everyone. As you know, I was scared. I'm a single father, and my son lives most of the time, all of the time with me. And when COVID hit, he was doing his GCSEs that year. And I just thought to myself, I can't be, obviously hospital wasn't a safe place to be, and I didn't want to expose my son to the additional risk of having someone coming back every night from potentially COVID. We were getting increasing number of admissions at the time. So I decided to take him up to Manchester to my parents, because his school had closed for the foreseeable. This was just like a day or so after the lockdown was announced, so shortly after his birthday, I think. But that was good for me in a way. It was awful not having him around, but it did give me that space, and I just had a natural calling. I don't know what came over me, and again, I'm thankful for the wellbeing team at Watford, for West Hart, for promoting this. But I just felt a calling around the time that we went into lockdown, so around April, to start the live stream, something that I'd done like for companies and clients before, but not really for the trust. So I every weekday morning for 6 consecutive weeks, shortly after we went into lockdown, I did a live stream, which was streamed on YouTube and Facebook, and I was really touched. Like a couple of weeks into it, I was getting members of staff coming up to me saying, thank you for what you do. It's making a difference. And I don't know why I did it. Obviously, it just came to a natural end after the 6 weeks, although I did it again a month or so later for Mental Health Awareness Week. And then 3 months on, my son came back from Manchester, brought him back, and I've been trying to teach where I can, but I haven't had that space there. But he's going to be going to university later in the year, so that space is going to open up. Let's see what happens. I do try and take every opportunity to get the message out, as it were. And I think the pandemic, for many people, it's shown the benefits of platforms such as Zoom, which really before the pandemic I hadn't used at all. I don't think most of the population had. No. Silver linings.
Yeah, exactly. If anyone had said to me, you're going to start doing videos and, live streams, I would have been terrified at the thought, but I think we just had to do it. It was our connection, wasn't it, with other people. So, well, brilliant that you were doing that whilst also, juggling everything else. I just want to go back to when you were saying I think it was 2014 or 15 when you were saying that was when you really started to up your meditation. Obviously, it had been part of your life all the way through. What made you kind of want to up your meditation at that point?
I have been exposed to meditation and the benefits actually came to me during medical school, when related to driving, having failed my driving test a few times, I just spontaneously thought to myself, I'm just going to sit down and meditate. And I just sat still for half an hour. And that time I passed my driving test, and in the back of my mind, it has stuck in as something that was clearly beneficial. Now, the hospital, I was a locum consultant in a hospital prior to working at Watford. I started in that actually before my training had finished. So I was acting up, and I was supposed to be acting up for a period of I think it was 12 weeks, and then it was extended to 3 months, and then ended up, I worked there for 2 years, and really, I mean, it's stressful, without a doubt. Being a doctor is stressful. Surgical training is stressful. Surgical training in London, teaching hospitals, is exceptionally stressful, especially some of the training hospitals. I'm grateful for the experience, but I did have a full head of hair before that. When I started as a locum consultant, it was a huge difference. So I felt an immediate relaxation, but it was a really hostile working environment, much more than I had been used to, a lot more. And I'm not going to mention any names, but a lot more backstabbing and just really the worst of surgeons concentrated in one unit. And it took a toll on me, which really wasn't recognized until maybe the second year I was there. And in between that job and starting as a consultant in Watford, I had a short break, maybe 5 weeks, where I started going to the gym because I was, 2 stone heavier than I am now. And I started meditation, although not daily, maybe once a week. I downloaded the Headspace app, and I thought, I'm going to get back into this. And when I started at Watford, I didn't really have the time nor the inclination for the gym. That just dropped off. The weight, the small amount of weight that initially dropped off came back on. So I was back at being I don't know, almost 12 stone back then. But the meditation, that did continue through the occasional headspace and so on. And then it was really the year after I went on a pilgrimage. It was actually the third time I've been on this particular pilgrimage to India. And when I came back, I didn't feel any different. But when I came back, the meditation became a daily practice. And I really, in my heart, committed to this being a daily practice. And boy, that, I don't know if it was the inner commitment or the fact that, like, when you do something for a certain number of days, it becomes a habit. But I noticed feeling more peaceful. People started commenting, and I said within a couple of weeks, people started commenting on the change. And I thought to myself, well, this was positive reinforcement. I thought I'm going to have to continue with this. and sure enough, I did, and it became daily, twice a day, and it was very much watching my breath, and I'm grateful because not only I think when you make that commitment that you're going to integrate meditation as part of your life, life itself changes around you to aid that process. And I found that started happening. So in that period after I committed to it, I somehow went all Marie Kondo, and like my house, the environment completely changes. So very, very. So all of these things have facilitated, and just like with every day, I was feeling the benefit and thinking to myself, this is just something I need to share,
Yeah.
I didn't want to, I felt so strongly, but I obviously didn't want to leave my surgical practice that I also really, really love and really enjoy. So I thought this is perhaps something that I can offer in the private sector in my spare time.
Yeah.
But I thought before I do that, I need some kind of legitimacy, really, for want of a better word, because I didn't want to sell myself as a doctor teaching meditation, because I mean I could do, and many people would buy it, but it wasn't really authentic. And I just don't want to exploit the medical qualifications.
Yeah.
And as I said, the diploma from the British School of Meditation just seemed perfect. The reviews and testimonials all seemed great. The actual course, when I did it, was fantastic, and it was really eye-opening. Mary Nielsen, who was one of the main instructors there, she was fantastic. Still have really fond memories of the course, Mary. Some of the aspects of it, like the mantra meditation where she played Om Mani Padme Hum, Buddhist mantra, and that was really so I enjoyed that, and I enjoyed meeting people who'd been through similar experiences. But really, I digress from the question. So in between starting at Watford and my previous hospital, it was more profound stress on many levels. The work-related stress in a really, really hostile environment, really hostile. I can't stress that enough.
Yeah.
Obviously, the pressures of my son, he would have been 10 at the time, so I had the support from my parents. Otherwise, I wouldn't have been able to complete my surgical training. They used to come down from Manchester during term time to look after my son. I used to concentrate all my own calls in the period that they were there. And then personal events as well. I just found it was all too much, and maybe at that time I was coming home and like having a gin and tonic or having a glass of wine, and I just thought, no, because it may be like a temporary respite, but half an hour later, you're still there with all the anxiety, all the thoughts from the previous day, or from the day. Something has to change. So I just took the opposite. That it was that something has to change. That came at the end of my previous job, and that and the remembrance of how meditation has helped me pass my driving test. So that's what.
Yeah, and I love that. What really impressed me then was where you said, I think it was where I decided to make it a commitment to it. And I think, like a lot of people dabble and do it and know that they feel better for it. But I think that's where you really see it grow, and yourself, the changes within yourself, is when you make that commitment. I call it my daily devotion, and it's something that I look forward to. I enjoy. It's exactly that.
It pulls me out of bed. This is the other thing. I've become so much more of a morning person now. In that the meditation, even if I set my alarm at 5, the call of meditation draws me out of bed at 1:45. And really, it's, I hear you completely. It's become so embedded. I'd rather go without my daily shower than my daily meditation now.
Yeah, it just feels like I'm ready, off we go, that kind of feeling. So people who maybe just dabble, and maybe it's part of like a tick list for them instead of like, it's something I've got to do. Sometimes don't get that feeling when it becomes something that is just part of the fabric of your life, isn't it? It's just as much as you would clean your teeth, you do a meditation. It's just like that. So going back to when you trained with us, you touched on doing the mantra meditation, and wonderful Mary Nielsen as well. What really stood out with the training for you? What was the bit that you really enjoyed the most?
I don't know. Meeting people from different backgrounds, definitely, because we had people from Buddhist backgrounds, people from various progressive paths in Hinduism, people from more secular backgrounds, different motivations for doing it. Just exposure to different aspects of meditation that I hadn't really considered. What stood out, as well as promoting, reinforcing that aspects of meditation that I wanted to teach, were some aspects of meditation that really were not for me. And I think if it's not for you, you can't teach it. And I haven't really tried. For me, and I know different teachers are different, but for me, the visualizations I found challenging, and I can talk for many reasons, and for the same reason. In fact, watching my breath became a little bit challenging. Really, it's the mental effort associated with it, and I thought, it wasn't. I intuited that meditation shouldn't be about mental activity, and even when you're doing something very subtle like watching the breath, there is that, you sense that tension of doing. It's not a complete relaxation, and that was really amplified very much so in visualization, the intense concentration required. Many meditation teachers do have the facility to teach that, and some do very effectively, but I personally can't.
Yeah, I think it's
so that was useful.
The name of it as well, because of visualization. I'm very visceral, I'm very much more, if someone said, feel, imagine that you are walking down a country lane, what does that feel like? I'm there. But as soon as somebody says picture or imagine, I'm just sat there feeling quite anxious about it, because for one, my brain doesn't want to picture it; it wants to feel it instead, you know. So yeah, there lies in the challenge sometimes. But yeah, and I think that's what we really love about when we're training, you know, our students at the British School of Meditation, is we say, look, here's a big variety of different types, and there's loads of techniques within this, and this is your opportunity to explore, but teach what feels really comfortable for you. And that's what you hit on. It's really important that you teach what is very comfortable for you.
And you hit on something in that you're a very visceral person, and something that I'd been exposed to but never really appreciated until I did the course was, and this was there was someone on the course who had a background. Their background was something body related or yoga related, but the teaching on body scan meditation. As I said, I'd been exposed to it and I'd listened to a couple of meditations, but actually to feel it and just feel how potent it can be, really. So I see the benefits. I've written articles on my blog on the benefits of body scan meditation. I utilize it in my day-to-day practice as a surgeon with patients, unbeknown to them. I'm utilizing aspects of it. So I do perform as an emergency surgeon. I do perform a lot of procedures under local anesthetic, and just taking the attention away from the scalpel makes a big difference. And how often do people actually give attention to the breath? And it's something simple like that. But you can use body scan meditation for surgical pain relief without a doubt. There may not be measurable effects, but from a consultant surgeon, I can tell you there is definite efficacy of these processes, and this is something I learnt and appreciated the benefit from as a result of the British School of Meditation course. So thank you.
Yeah. Oh, wonderful. And that fascinates me, what you've just said. I would love to learn more about that. I'm going to look at one of your blogs with regards to that. So one of what I really like about you is that you've got this really lovely measure of a balance between science and spirituality. And I know that you are now a spiritual teacher as well. Tell us a little bit about that, because that is just really interesting to me.
Yeah, I really didn't expect that. And as I said, as I mentioned, I didn't go into meditation really for the spiritual benefits per se. Really for like increasing the space, more resilience at work, for those reasons. And I've been let me see how long, maybe a couple of years and I calculated I'd have to be watching my breath till at least over the age of 70. And then by expert measures, I'd be considered an expert in meditation, or for an expert in watching my breath. So I think 2 years into that breath watching practice, which really had established a deafness, slowness of mind, I felt that resistance that I recognized from visualization. I was feeling a mental effort, and it came to the point of thinking to myself, is this it? Is this it? And then at the same time, I was reading a lot of meditation literature. I was reading a lot about doing the 180 and turning around and looking within, and all these things were really, really abstract terms. They meant absolutely nothing to me. And then I came across a couple of spiritual teachers, and one of the teachers from the Advaita Vedanta tradition of Hinduism started talking about a sacred text from the Vedic tradition called the Drisha Viveka. This is a book that stands for the nature of the seer and the seen. And interestingly, and this is a whole other story, my colleague at work also meditates. He mentioned this teacher 2 years previously. And when I first came across this, and it's a series of lectures it's 8 lectures. I watched the first one on YouTube, and I ended up watching all 8 back to back, all on self-observation and self-inquiry. And then a couple of weeks later, I came across a spiritual teacher who was living in Oxford at the time, called incidentally, this spiritual teacher was also giving a talk in Barons Court, which is just 6 tube stations away from me. And it was exactly the same dialogue. This Hindu spiritual teacher in robes, this Western spiritual teacher, all talking about self-inquiry, all talking about consciousness, all saying exactly the same things. I met this teacher. My practice turned very much from watching my breath to that of self-inquiry, self-observation, turning my attention around to that which is aware of the breath, that which is aware of the changing perceptions. Importantly, that which is aware of the changing thoughts. And there comes a realization that there's an observer and there's the thoughts. The observer is not the thoughts. The thoughts never can be. Thoughts cannot be self-aware. There's always an awareness of the thoughts. It imbibed 2 principles in me, and this is why my teaching practice has evolved, because it's 2 very, very basic principles. And the first one, for the first one, you may need to establish a mindfulness practice, but the first one is to instill in your inner psyche that the present moment, this now, has been, and always will be a place of peace. Now, you can hear someone say that, but sometimes it does take a meditation, a mindfulness practice to establish that within your inner psyche, that this now has been, and always will be a place of peace. And what the self-inquiry practice taught me that every time we're taken away from this now, this place of peace, it's always an illusory character, an illusion because there's no reality to this character, an illusion of me, either in an illusory past or in an illusory future, imagining stories about me. And there is no reality to the past. There's no reality to the future. They're made out of thoughts that are arising in the present moment. There is nothing but the present moment. There is nothing but this now, this eternal now. And it's not something that happens immediately, but certainly the more attention you give to awareness, the more awareness or self-awareness, the more awareness rises within you, the greater the sense of intuition arises within you, the greater the degree of compassion arises with you. In that, through this practice now, the interaction between myself and patients has changed. The degree of empathy has just evolved to extraordinary levels. And this is something that I mean, certainly some patients who will have such a background will recognize that this is no ordinary surgeon, but other people, all the patients now do sense that I empathize. They can sense that. And I can sense that they can sense that.
I think that's it. I think with self-inquiry, what we do is like peeling back the layers of an onion, and we're peeling back all the labels that we've kind of given or, have been provided for us. And there is that connection, that oneness, that where we can feel that empathy. It is incredible, isn't it, that practice? You do feel a sense of interconnectedness, with everybody around you. So your patients are very lucky to have you as their surgeon with regards to that. It's wonderful. Thank you for sharing that with us. And I can see what a beautiful practice that is for you. And I love it too. But I can really, you were shining. Not that everyone will see this because of the podcast, but I'm watching your video and you were shining when you were talking about that. It's lovely, really, really lovely. You can feel that coming from your heart. There's so much I would love to discuss with you, but we're coming up to the end now, and there's one thing I just want to ask you. When you are teaching, what's the best aspect for you? What do you really like about teaching meditation?
I'll kind of answer that in two parts. The people that benefit the most from meditation are the people who sense that it is going to help them, not those who meditation is forced upon them. But for those who are receptive to it, and certainly the audience this year, for Mental Health Awareness Week. And you see this more with face-to-face meditation practices, is when they come in with their tensions. And obviously, hospital is a extremely stressful environment. They come in with their tensions. They come in with the burden of the thoughts. And you just bring them to the present moment, the place of peace, which is always there. And just at the end of the meditation session, just seeing the smile on their faces is the best aspect.
It's you can feel it, that lifting of pressure, can't you? You can, it's palpable, isn't it? It's wonderful. So if people want to find out a bit more about you, you've got your website, haven't you? You got your website?
Yeah, it's www.pandey.healthcare.
And you've also got your app.
That's available on the Apple App Store at the moment, soon to be on the Android store. That's Pandey Integrated Healthcare.
Wonderful. It's been such a pleasure to chat with you. Like I said, I wish we had more time because there would be more I'd like to chat to you about. But thank you so much for joining us on the meditation movement. Thank you for your time. You take care. Bye-bye.
Bye, Sarah.